It's tabled.
My Lords, I spoke on Tuesday about the structure my colleague Paul Raquel, a Labour councillor in Newham at that time, and I wrote for the then Government Minister Hazel Blairs for the new company that would deliver the Olympic legacy in East London. And some of the key people that were invited to be directors of this company with a clear vision and narrative focused on delivery. In East London live people from every nation on earth. Indeed, we did some research. We thought Greenland wasn't there, and then we found a family in Newham that was from Greenland. We clearly couldn't have a representative from every nation on the Olympic Park Legacy Company. Not possible. Baroness Ford was chosen as a Labour peer at that time by a Labour Prime Minister to be the chairman of the board. A very experienced player in the regeneration world from Scotland, not East London. I think at that time she was a little embarrassed that I wasn't chairing it, an East Londoner, given all the early work we'd done on helping the East London Olympics happen. But I was not a Labour Party member. I therefore couldn't carry the then government with me. She could. I wasn't concerned about this, actually. My colleagues and I in East London were concerned about whether she actually had the knowledge and skill that could add real value to this important project and the public sector organisation that had been created. She was excellent and had an objectivity I couldn't possibly have. We needed both things on the board: deep local practical experience and objectivity. I was asked to chair the Regeneration and Community Partnerships Committee because I think she thought I knew quite a lot about these local issues and delivery, and was trusted by local people and had a track record of delivering in place and in local neighbourhoods. Because my colleagues and I had delivered real projects with local population, we didn't know one thing about the place and neighbourhood. We knew in depth many things. It was all about finding the right experienced people, not those who say they represent something or somebody. The mayors of Newham and Hackney were there because they were impressive Labour leaders in East London who were turning around troubled local authorities. I was asked to join the OPLC board as a person with deep long-term roots in both Place, East London and a neighbourhood, Bromley by Bow. I could speak and reflect back into the board, not one thing, be it the environment, but also health. We were responsible for 43,000 patients. I'd been a mental health act manager for quite some years, locally. I think she chose me because I had a deep and wide experience of the people, place and local neighbourhoods, and because of the practical work we had done in East London over quite some time, 3 decades actually. It was about practical experience of place and neighbourhood and delivery. It was not about a person who thought he or she was representing one group or another or a particular topic. Experienced people bring many things to the board with them. I worry about the disabled person on the board who only thinks they can talk about disability issues. This is very condescending. Or the young person who can only talk about young people's issues. They can talk and have views on everything. It is about finding the right quality person, but they must have in-depth knowledge of what is actually going on locally and a deep understanding of the practical issues surrounding delivery. This is absolutely crucial. There is a wider problem with some representatives on committees and structures because they represent other agendas and they have mixed loyalties. They can't focus on the task of the board because they have mixed loyalties elsewhere. They don't therefore prioritise the needs of the organisation they are sitting on. There is a lack of clarity about this, and we will all have experienced this, I suspect, on boards we have sat on. We need to get now very clear about these democracy and delivery issues, what I call the 2 Ds. I have listened to a lack of clarity around these issues in successive governments in recent years. We now must get clear if this new NHS structure is to really deliver the transformation we all now want to see and to deal with the health inequalities we rightly all discussed this morning.
I also spoke on Tuesday about my concerns of listing the specific membership for the NHS England board, and I have similar concerns to those of the Right Reverend